Okay, this week we're talking about infancy and toddlerhood, chapter 4. Actually, this chapter is going to last for two weeks. It's going to take 2 weeks to get through this one. Some of this material seems to me like we've gone through it before, but here we go. This is my grandson and my daughter. That's my daughter, and that's my grandson. This is her when he was just a baby, as you can see. You can see how tiny he is, and then this is him at 3, I think. Yeah, that's him at 3, and you can see that he's now quite large, and he's grown quite a bit. Children grow faster during the first 3 years, especially during the first few months, than they ever will again. This rapid growth rate tapers off during the second and third years. By 5 months, the average baby boy has doubled his birth weight, and he will triple it by 1 year. By his second birthday, a boy will only add 5 more pounds to his weight, and then things will slow down quite a bit. There he is. There's my grandson with me in Denver, actually. First time he'd ever seen snow. Boys' height will typically increase by 10 inches in the first year to about 30 inches. They will gain 5 inches in height the second year to 3 feet tall. Baby begins teething at 3 to 4 months, but they typically don't emerge until the 5th or 9th month. At 1, they will have from 6 to 8 teeth. By 2.5, they will have a mouthful of 20. And then, oh, there he is. There he is with his mouth full of teeth. And we've already seen this picture before. That is a Baltimore or an Indianapolis Colts. That's an Indianapolis Colts football. Yeah, Indianapolis Colts. That's an Indianapolis Colts blanket. My dad was a Baltimore Colts fan, and then he became when they moved to Indianapolis. Of course, we're from Indiana. He became an Indianapolis Colts fan, and there's my grandson. That's him with blonde hair. As you can see, his hair turned dark. Well, it's darker here. You can see it's darker. It's dark brown now, as weird as that is. In the womb and after they are born, children develop from head to tail. That's known as cephalocaudal. They develop cephalocaudally, and from the inside out, proximo-distally. The head and the brain are the largest thing about a developing fetus and a newborn. At 2 months gestation, it takes up to 1/2 the body length. At birth, it takes up 1/4 of the body length. As adults, our heads are about 1/8 of our body length, and that is an example of it. Here the head is about a half. Here it's about 1/4 when they're first born. And here, as a 25-year-old, it's about 1/8 of their body length. And there's a boy, and we see exactly the same thing. At 2 months, half the body length. At birth, 1/4, and as an adult, 1/8. Genes interact with the environment. For example, nutrition and living conditions impact general health and well-being. Well-fed, well-cared for children grow taller and heavier than less well-nourished and nurtured children. Better medical care, immunization, and antibiotics have led to better health. And of course, you can see this is a family in the old days. You can see how happy she is. She's not real happy either. Well, there's not a lot of not very happy people there in that picture. But everybody's smiling in this picture. And this is a more modern day picture, of course. Maybe it's because they have to wear so many clothes. Back in the old days, everybody had to wear long dresses if they were female, and if they were male, they had to wear ties and whatnot. Bottle feeding babies did not become possible until the 17th century in Europe. Before that time, if a mother didn't want to breastfeed her own baby because of inconvenience, sagging breasts, she would find another woman and have her breastfeed for her. This woman was known as a wet nurse. Of course, we talked about this before. In the 19th century, an increase in infant deaths was blamed on wet nurses and bottle feeding. In the 1920s, bottle feeding once again became popular and didn't go out of vogue until the 1970s. And of course, I raised my children, and my daughter was born in 1969. My son was born in 1972. My daughter was bottle fed exclusively, and my son was breastfed until my wife left when he was 9 months old. And at that point, he got weaned really fast because she left. Breast milk is almost always the best food for newborns and is recommended for at least the first 12 months. Parents can avoid obesity and cardiac problems in themselves and in their children by adopting a more active lifestyle for the entire family and to breastfeed their babies. Breastfed babies have fewer gastrointestinal infections. Research has refuted previous research that breastfeeding reduced the risk of allergies. Breastfeeding for 3 months reduces the amount of wheezing in babies. There is no proof that breastfeeding reduces asthma later in life. Breastfed babies are less likely to develop otitis media, and there's a reason for this. When somebody is breastfeeding, as you can see, milk doesn't, what happens with babies that are bottle fed, they're put to sleep with the bottle, and they will drink, they'll drink on their bottle, and when they go to sleep, milk will dribble out of the corner of their mouth and leak into their ear, and that's one of the reasons why bottle-fed babies, especially babies who were put to bed with their bottles, will have ear infections. Otitis media. Atopic dermatitis is a chronic inflammation of the skin. Breastfed babies are less likely to develop atopic dermatitis. As you can see, that's atopic dermatitis. We see that I was watching an English film, and the baby had atopic dermatitis. I was a little shocked that they had the baby on television. Breastfeeding protects an individual from becoming obese throughout the individual's life. Breastfed babies are less likely to develop type 1 diabetes. Breastfed babies are less likely to develop type 2 diabetes as adults. Breastfed infants are less likely to die from SIDS. Women who breastfeed are less likely to develop breast cancer. Women who breastfeed are less likely to develop ovarian cancer. And it's a tumor on your ovary, of course. Women who breastfeed are less likely to develop type 2 diabetes than women who don't breastfeed. Women shouldn't breastfeed when they have an active infection that may be transmitted in the breast milk. This includes HIV. Women should not breastfeed if they have an active case of tuberculosis. Tuberculosis is caused by the bacteria Mycobacterium tuberculi. A woman who is taking a drug that may be transferred to the infant in her breast milk should not breastfeed. And this woman, of course, is cooking opium and sucking up the fumes. Taking hormonal birth control pills does not get into a woman's breast milk and therefore does not affect the baby. SSRIs, selective serotonin reuptake inhibitors for depression, are expressed in the woman's breast milk and can cause lethargy, poor feeding, and fever in an infant that is exposed. Of the SSRIs, Prozac seems to have the most negative effects, and Zoloft has the least. So if you have a woman that is breastfeeding and she is suffering from postpartum depression, Zoloft is the drug of choice for breastfeeding mothers. Breastfeeding women who find themselves needing pain control can use the following medications safely: acetaminophen, which is Tylenol; ibuprofen, which is Motrin; oral codeine or hydroxycodone. Morphine and other methods of delivering codeine are contraindicated. Morphine, not a good idea. The following drugs will cross into the breast milk of the mothers and cause varying degrees of problems with the breastfeeding infant: marijuana, cocaine, heroin, phencyclidine or PCP, and amphetamines. So these are drugs that should be stayed away from if a woman is breastfeeding. Alcohol readily passes into breast milk. Infants who ingest milk contaminated with alcohol will drink less milk and maintain a disrupted sleep pattern where they sleep for reduced amounts of time. Heavy drinking by a breastfeeding woman may cause a drunken effect from her infant. They also have loss of pain sensitivity, deep sleep, inability to suck, and deep respiration. Women who smoke will have nicotine in their breast milk. In the past, it has been reported that nicotine in breast milk caused infants to have more respiratory ailments. However, new studies show that while it isn't suggested that women smoke if they are breastfeeding, there is no proof that there are any negative consequences. Nicotine levels peak at 30 to 60 minutes and take 3 hours to clear. So potentially she can smoke right after she breastfeeds, and as long as she doesn't breastfeed for another 3 hours, then she's probably, the baby will get very little nicotine, if any at all. The world has changed considerably since your grandparents or even your parents were children. The leading cause of death until the 1970s was still childhood illnesses. And of course, as I was born in the 50s and the 60s, I had measles, mumps, I had chicken pox, I had fifth disease, I had all the childhood illnesses. Now diseases that, and my daughter was born in 1969. And my son was born in 1972. So I was right at the end of the time when childhood was very dangerous, and children really needed to get vaccinated. Now diseases that used to devastate whole areas of the globe have been all but eradicated. Polio, measles, whooping cough, even chickenpox are no longer the scourge of youth. Of course, my kids were vaccinated against polio, measles, and whooping cough, but not chickenpox, and both of them had chickenpox when they were kids. One reason some parents hesitate to immunize their children is fear that vaccines, especially pertussis vaccine, may cause brain damage. Failure to receive vaccinations appear to be more deadly. 18% of the deaths in developing countries are due to preventable diseases. Vaccination has been so successful that smallpox has been eradicated worldwide. And there are very few cases of smallpox. They're very isolated in isolated areas. But for the most part, smallpox has been eradicated. The immunizations, at 2 months, the baby will get a shot for diphtheria, pertussis, tetanus, polio, influenza, and pneumococcal. Pneumococcal, of course, is pneumonia. At 4 months, the baby will get a shot for diphtheria, pertussis, tetanus, polio, influenza, pneumococcal, and hepatitis B. Polio, of course, is oral, and the rest of this they can give in a single shot. At 6 months, the baby is immunized against diphtheria, pertussis, tetanus, influenza, and pneumonia again. At 1 year, they are given a vaccination for influenza and pneumococcal. At 15 months, they're given a immunization for measles, mumps, rubella, influenza, and varicella. Varicella is the chickenpox. Varicella zoster not only causes chickenpox, but it also causes herpes, and it also causes shingles. So at 15 months, they are given a vaccination against chickenpox. At 18 months, hepatitis B, polio, diphtheria, pertussis, and tetanus. At 4 to 6 years, they're vaccinated against diphtheria, pertussis, polio, tetanus, measles, mumps, and rubella. At 11 to 12 years, they get measles, mumps, and rubella. At 14 to 16 years, diphtheria and tetanus. These are your tetanus shots that you need to keep updated. There we go. At birth, the brain weighs about 25% if it's of its eventual adult weight of 3.5 pounds. By age 3, the brain will be 90% of its total size. By age 6, it is almost at its adult size. And that's one of the reasons why kids' heads are they look so big, because their brains are actually as big as they're going to be almost. The brain's maturation takes much longer than was previously thought. Brain growth spurts coincide with changes in cognitive behavior. One of them, of course, is the learning of language, and we learn language from birth until about age 12, at which point that's it. We've learned what we're going to learn as far as language is concerned. Some people will maintain these neurons in their brain, and they have a gift for learning languages. There's nothing you can do about it. It's not like you can go, don't take those out, those brain cells out. I still may need them to learn a language. So if you're going to learn a language, it's best to try to learn it before age 12. It all depends on the environmental stimulation, of course, how much stimulation you're getting. If you get a lot of stimulation, then brain growth will be excessive. If you don't get any brain growth, or if there's very little environmental stimulation, then the brain growth will be limited. We know this by looking at individuals who have concentrated stimulation. If we look at their brains, then what we see is a lot of convolutions. We see a lot of surface area to their cerebral cortexes. If we look at somebody who has very little stimulation, somebody who's living in a fairly sedentary environment where they aren't learning languages, they're not going to school, there's not a lot of stimulation, then their brains have very few convolutions and sulci and gyri, as it were. The two hemispheres are specialized. The left part of your brain is primarily for language, and the right half of your brain is for visual spatial. The brain represents 70% of the weight of the nervous system. The occipital lobe is this lobe right here. It's in the back. That has to do with eyesight. The temporal lobe is hearing, and that is on the sides, right by your ears, and that has to do with hearing and language. The parietal lobe has to do with movement, touch, that type of information. It's right on top of your head. And then the frontal lobe has to do with higher level thinking, such as speech and reason. And for this reason, if you get a blow to the head, we try to determine if there's any damage in any portion of your brain. So one of the ways that we will do this is we will ask you a question. How many fingers am I holding up? That has to do with vision. It also has to do with the ability to hear and understand what I'm saying. So if I'm holding up 3 fingers and I'm asking you how many fingers am I holding up, and you say, I don't know, 5, 6 fingers, I don't know, I can't really see very well, that means that you have damage to your occipital lobe. Probably it's just a bruise of some kind. It will probably go away. If you don't understand what I'm saying, of course, that means that there may be damage to the temporal lobe. They'll ask you who's president, those kinds of things. This has to do with memory, and that also has to do with your frontal lobe. And of course, they will. These all have to do with concussion protocols that they have. So if you answer any of the questions incorrectly, then they won't allow you to go back in and suffer possibly worse damage. Smiling, babbling, crawling, walking, and talking are possible due to rapid development of the brain, particularly the cerebral cortex, and this is because the brain has what we refer to as plasticity. It is modifiable, and it will become more and more complex as you get older. This is a normal brain. As you can see, it has grown fairly large. This is the brain of a child that has been neglected, very little stimulation in their life, and for that reason, the brain hasn't grown nearly as much. Throughout early life, the brain is creating more and more complex neuronal pathways, and this is an example of that. From even before birth, the brain is integrating neuronal coordination of muscle groups, a process known as integration. At the same time, select neurons are being developed to have a specialized structure and function, a process known as differentiation. When neuronal cell functions are no longer needed or no longer used, cell death occurs and the brain prunes the excess brain cells. If you don't need them anymore, they get rid of them. This is one of the reasons why babies will have instinctual reflexes right after they're born, and those reflexes will go away. If you don't use them, they go away. So those structures that were needed when humans were living in very dangerous situations like swimming and walking for a newborn baby, all those things go away until they're, and of course they come back later. You can learn to swim, you can learn to walk, and all those other things, but you have these abilities right after you're born. And of course, all that is pruned away because you don't use them. And if you don't use them, if you don't use it, you lose it. Molding the brain, early experience can have lasting effects on emotional development and the capacity of the central nervous system to learn and store information. Sometimes corrective experience can make up for past deprivation. As we see, this is a toddler's brain. This is a normal toddler's brain, and this is a deprived toddler's brain. We're not getting nearly as much reaction from the deprived child as we are from the normal child. Stimulation, that's what children need. Myelin, a fatty insulating substance, begins about halfway through gestation in some parts of the brain and continues into adulthood in others. This accounts for improving abilities at various times during adulthood. Milestones of motor development. Babies first learn simple skills and then combine them into increasingly complex systems of action. Humans begin to walk later than other species, possibly because babies' heavy heads and short legs make balance difficult. One test that has been developed to chart motor development is the Denver Developmental Screening Test that charts a child's progress and compares it to other children of similar age and gender. According to Thalen, normal babies develop the same skills in the same order because they are built approximately the same way and have similar physical challenges and needs. And this is one of the proofs that despite children being born in Indonesia and in South America and Africa and New Guinea, Asian babies, they're all almost identical. DNA-wise, of course, there's only 0.2% difference between one person and the other. We set too much store for the texture of your hair or the color of your skin. It's things that we can see. They're not really that important, as it turns out, because we're all just about the same. And if we took all children and we put them all in one big room and taught them all exactly the same thing, they would all develop exactly the same. Just because somebody is from Australia, they wouldn't develop that much differently. Not until babies can get around by themselves do they learn from experience or from a caregiver's warning that a steep drop-off can be dangerous. And of course, as you can see, this baby is about to crawl across. This is a kid. This is a baby goat. And the baby goat is not going to walk across the plexiglass, but this baby's willing to do that because they can't see there nearly as well. They haven't learned that. But this baby goat that is much younger knows enough not to walk across that plexiglass. If there are chances to explore their surroundings, motor development is more likely to be normal. Some cultures actively encourage early development of motor skills, and other cultures don't. Gessel concluded that children perform certain activities when they are ready, and training gives no advantage. My daughter wanted to raise her child as an athlete, and he's not bad. He's okay. He plays golf and he plays tennis. I beat him in table tennis, so that's something. But here, she gave him a giant golf club and golf ball. He wasn't too bad, actually, and he started playing soccer at a very, very young age. And he's not bad. Like I said, he's not bad. He's got 2 games tomorrow. I'll tell you how he does. But just because you train them to do something doesn't mean they're going to be exceptional at it. Findings do not indicate whether changes in the brain or in muscle strength or both are involved in motor development, but they do suggest the interaction of biology and environment. Touch and pain seems to be the first sense to develop. Pain experienced during the neonatal period may sensitize an infant to later pain, perhaps by affecting the neural pathway that process painful stimuli. Preference for pleasant odors seems to be learned in utero and during the first few days after birth. Preference for the fragrance of the mother's breast may be a survival mechanism, of course. Newborn's rejection of bitter taste is probably another survival mechanism, since many bitter substances are toxic, and here the baby is rejecting the lemon. Hearing is functional before birth. Auditory discrimination develops rapidly after birth. Hearing is a key to language development, so hearing impairments should be identified as early as possible. Otherwise, their speech will be impaired. Vision is the least developed since at birth. Vision becomes more acute during the first year, reaching the 20/20 level by about the 6th month. Binocular vision is where the individual uses both eyes to focus. This leads to the perception of depth and distance developing at 4 or 5 months. This is my grandson when he was first born. As you can see, he's looking at his mother and trying to figure out who she or what she is. But he can't really see very well. In recent decades, survival rates have improved in all regions of the world, but in the United States, there continues to be a disparity between different racial and ethnic groups. African American, American Indian, and Hawaiian babies have twice the infant mortality as other groups in the United States. Birth defects, congenital abnormalities were the leading cause of infant deaths and were the leading cause of infant deaths in the United States in 1998. As you can plainly see, this is 2006. What caused the infant death? Birth defects, 5,819. Low birth weight, 4,841. SIDS, 2,323. This is in 2006. Maternal complications, 1,000. And anyway, unintentional injuries. Infant mortality for white Americans is around 6 per 1,000, while it is over twice as high among African Americans. Disparities in healthcare are considered the reason for differences, and the larger number of teenage women giving birth to low birth weight babies. This is in 2007. As you can see, African Americans are at 13.31. And non-Hispanic whites are at 5.63, so it's more than twice. And this is 2018 statistics. Thank God they've gone down. What is this? 10.8 for non-Hispanic blacks, Native Americans, Hawaiian or other Pacific Islanders. Oh, 9.4. American Indians were Alaska Native, 8.2. and non-Hispanic whites. Once again, less than half. It's gone down. It was 5.63, I think, before. It's gone down by 1, which is good. This is in 2018. And of course, this is at 13, and now it's at 10.8, so it's much lower. But you can see it's still less than or more than half as many in the African American community, and twice as many in the whoops, no, it's not quite twice as many among American Indians. Low birth weight babies are 5 to 10 times more likely to die from SIDS as normal birth weight babies. When an infant dies in a family from SIDS, later born children in that family have a 2 to 4 times greater probability of dying from SIDS. Infants who hold their breath for 10 seconds or longer have sleep apnea. 6% of infants with sleep apnea die from SIDS. African American and Alaska Native children, Tlingit and Aleut, are 4 to 6 times more likely to die from SIDS. This is the only picture I could find of Alaska Native babies. These are African American babies, of course. SIDS occurs more frequently in infants from lower socioeconomic circumstances. When there is smoke in a baby's house, they are more likely to die from SIDS. Infants who are put to bed with a pacifier are less likely to die of SIDS. When a baby is put to bed with a fan in the room, they are 70% less likely to die of SIDS. After the neonatal period, death due to injuries are the third leading cause of death after SIDS and birth defects. Just under 1/4 of the injuries are intentional. That's homicide. The leading cause of death by injury is homicide. Intentional death. Other leading cause of death include suffocation, motor vehicle accidents, or choking on food or other objects. And that is the end of the chapter. So that is it. Next week I will finish the chapter.